How to finally end rotator cuff impingement and have a pain-free shoulder in less than 5 minutes per day. If you've been suffering from shoulder pain or rotator cuff tendonitis and you found it increasingly difficult to do the things you love, including working out, sleeping pain-free, using your arm at work, then what I have to share can help you end your rotator cuff impingement pain and help you avoid bone spurs from forming at the edge of your acromion. It can also help you avoid rotator cuff tears, which are a direct result from these same bone spurs that cut into your rotator cuff tendon as you lift your arm, and ultimately can help you avoid painful rotator cuff surgery. Now you may be wondering, why does rotator cuff impingement syndrome occur? There are many reasons why you get shoulder impingement. The most common is due to a lack of strength of specific muscles in your shoulder joint, as well as postural changes affecting the joint space in which your rotator cuff muscle needs to function. Unfortunately, most doctors and clinicians have no idea how to prescribe and provide their patients the correct sequence of exercises to reduce the shoulder impingement and avoid fraying of the rotator cuff due to bone spurs. As you may be well aware, the risk of not addressing shoulder impingement can and will lead to shoulder weakness, pain, and even permanent damage to your shoulder. Now, how exactly does rotator cuff impingement work? Before I present to you the solution to shoulder and rotator cuff impingement, it is important to understand what exactly happens, and we will do this by looking at the following image. This is an anatomical view of your shoulder depicting the muscles and tendons and bony regions that is involved in a rotator cuff impingement. Imagine that this is the front of your body, this is the back of your body, and this is a side view with your arm or humerus facing us in the middle. Your rotator cuff muscles are responsible for keeping this bone, your humeral head, stable as you lift your arm forward and to the side. When you have postural changes and weak rotator cuff muscles, what occurs is when this bone moves upward, it pinches this rotator cuff tendon, typically your supraspinatus tendon, against the acromion. Over time, because of this impingement, bone spurs form on the end of the acromion, and this starts fraying or cutting into your rotator cuff tendon, ultimately leading to a severe or even a complete rotator cuff tear. Here's another picture. This is your arm dangling down. As the arm gets lifted up, the space gets taken up completely, and it's basically bone on bone pinching whatever is in the middle. In this case, it's the subacromial bursa and your rotator cuff tendon. Like I said, this does not happen immediately. Over time, you form bone spurs and rotator cuff tears, and this is definitely preventable if you take the right actions. Now, what are the tests to determine if you truly have rotator cuff impingement? You might be watching this video and you're not sure of what to do, how to interpret your symptoms, and to know exactly if you have this impingement. While there are a couple of manual tests that doctors or therapists can use, this is just one of them. And this can quickly tell them what happens in the shoulder joint, and if you have severe pain with this movement, for example, it can indicate that you are very likely having a rotator cuff impingement. Other tests include x-rays or even MRIs, and doctors can see if there are bone spurs forming in the acromion. They can see if there are calcific tendonitis or bursitis in your shoulder joint, all presentations of impingement. Now, I've alluded to two of the main causes of rotator cuff impingement. There are other reasons why you get impingement as well. But for illustration in this video and why most people get rotator cuff impingement, we'll look at the first cause, and that's bad posture. What happens over time because of our sedentary lifestyles, our shoulders really get rounded, we get into this forward head position, and this can cause impingement in our shoulder just because of poor body positioning. Many times in the clinic we use a standing wall test to ascertain how good your posture is. You can try it yourself with your feet a few inches away from a wall. Try and just lean up against the wall, feet about hip width apart. If you find that your head and your shoulders aren't touching the wall, most likely you're succumbing to this forward posture because of tight chest muscles, tight hip muscles, just to name a few. And this can lead to impingement. Now, weak rotator cuff muscles and postural muscle strength is one of the main reasons why you have this impingement, and this can be remedied by performing some very specific exercises. Here are just two advanced exercises that can be done. This exercise right here works your infraspinatus muscle, and the empty can exercise that you use with an elastic band is also a very good strengthening exercise. Actually, nowadays we prefer the hand to be rotated up and not downward like it's depicted in this picture. So in the beginning of the video I mentioned to you that I have a solution for you if you are a candidate for rotator cuff impingement syndrome. I want you to not try and figure this all out by yourself. I've created a simple ebook that I believe cuts to the chase in terms of getting your shoulder pain reversed and reducing rotator cuff impingement, and you can do this in less than 5 minutes per day with specific stretches and strengthening exercises. What you will learn when you go through the shoulder pain relief guide is you will learn how to strengthen your rotator cuff muscles correctly. You learn the exact exercises you must avoid to avoid further impingement and damage to your shoulder. You are also going to learn how simple changes in your posture can increase your range of motion by at least 50% in the next day. I'm also going to teach you to implement targeted stretching exercises designed to reduce your risk of rotator cuff tears, bone spurs, and impingement of your rotator cuff. And again, like I mentioned, you're going to learn how to do all this in 5 minutes. Now, to get started, all you need to do is click on the order button or the image below, and it will help you to the area where you can get access to the ebook. I want to thank you very much for your patience in watching this video. I hope it shed some light on rotator cuff impingement syndrome and also a solution which I hope you'll take me up on. Thank you so much.